This is the of a human cadaver from the level of C3 to C7 vertebrae shows the complex anatomical arrangement of the cervical region, including the vertebrae, spinal cord, muscles, vessels, nerves, airway, tracheal rings, esophagus and other structures related to it. This region represents the lower cervical spine, an area critical for neck movement, breathing, swallowing, and neurovascular supply to the head and upper limbs. The cervical spine between C3 and C7 forms the lower cervical region, located between the upper neck and the thoracic inlet. In a transverse section, structures can be identified from posterior to anterior and lateral compartments. This guide describes a systematic cadaveric dissection of the cervical region between the C3 and C7 vertebral levels, exposing superficial structures, muscular layers, neurovascular bundles, and deep visceral components. The dissection proceeds from superficial to deep,